I'm Bipinkumar Rathod. Right now, I'm working as a consultant, health informatics and digital transformation at African Medical City in Ghana. But I'm based in Mumbai right now. So, 1 minute. So I'm starting the slideshow. So, is my slide now visible in a full screen? Yeah. Okay. Thank you. Okay, so now let's start with the course overview, which is a block structured into the total of 4 units. The first unit is digital health, sustainability, and development. The second unit, second, third, and fourth that we are going to take in subsequent days, tomorrow, the day after tomorrow. The second unit is information technology in health, artificial intelligence in healthcare, analytics in healthcare management. Okay. And the block 1, we are going to cover a digital health ecosystem in India, health system transformation, information technology standards, but we are going to focus particularly IT standard for healthcare, cybersecurity, and how new service delivery models is emerging in hospital and healthcare industry in India. So as an IGNOU student, you already know this is the counseling session, but I will elaborate as much as I can with the very typical unknown subject and unknown topic that coming into our slides in the due course. So total in the block 1, we have 5 units. This is in front of you at a glance. So unit 1, that's to deal with the overall digital health ecosystem, which consists of EHR, electronic health record, clinical and digital workflow. Unit 2, we will deal with the health system and digital transformation. What sort of new models right now are emerging in the service in advent of the new digital health tools and technology? We will take few examples of the virtual hospitals, home-based care, remote monitoring, and what sort of hybrid care are emerging in the corporate hospital and the government hospitals. Unit 4 is to deal with the IT standard specifically designed for the hospital and healthcare industry, particularly that is divided in the 4 main components. One is a licensing, second is a compliance, interoperability framework, and so on. And the unit 5 is to deal with the cybersecurity, that to deal with the data and digital in the hospital and healthcare industry. So first of all, what is a digital health? So there are many specific definition about the digital health, but in my opinion, from my experience, any digital tools and technology, even it's a simple mobile or maybe even telephonic call that you are inquiring in the hospital that you would like to see this particular doctor. So this is, you are using any digital tools and technology for your healthcare delivery or healthcare seeking behavior. That all comes under the umbrella of digital health. And that divided into the wearable, mobile, telemedicine, and the healthcare information technology. So why digital health now and in the future? So basically, any country in the globe is trying to achieve universal healthcare. And there are three pillars and digital enablers to achieve universal healthcare. So here you see health for all, three main pillars where you put your digital enablement to achieve your accessibility, affordability, and the continuity of care. So objective is to use digital health is to achieve universal healthcare for our nation. And by using the digital enabler, what we're trying to achieve? Accessibility, affordability of the care, and continuity of care. So when we talk about the digital health ecosystem, we need to identify what are the components that we are learning in the digital health ecosystem. It is a gamut of service, gamut of tools, gamut of application, and gamut of players that actually creating digital health ecosystem. So here you see the key components listed here in front of you in the slide, and we will elaborate further each digital health ecosystem component. So let's see what are the global milestones of the history of global digital health system evolution. So basically, if you see in 1970s, the MySyn, PIP, and CaseNet, that's the actual digital health component. When they have started using the computer and computer science and computer technology in delivery of the hospital and healthcare. In the rest of the earth history now, you see, by 2020, Google also jumped into the digital health evolution, creating the Google DeepMind. So now let's talk about India, how we have started using the digital health and digital health component. The most significant event that happened, it's in 2000 when ISRO and Apollo Telemedicine launched first of its kind SATCOM, means satellite communication based telemedicine. So ISRO provided the satellite communication and Apollo Telemedicine provided the doctor and the medical services. And now India is one of the largest digital ecosystem in the world. We are providing lots of digital health services to our doctors, to the hospital, to the patient, to the family, and at the public in the large. So now let's elaborate the digital health adoption challenge in India. As you know, that India is evolving its economy, it's evolving its infrastructure, it's evolving its adoption of the new technology. Digital health seems to be a straightforward adoption for India, but it's not. So if you see the the pointers under the green headline, infrastructure and literacy barriers, and on the right side in orange strip, you will see the privacy, security, and integration challenges. So you see, even it looks like a straightforward digital tools and technology you start using the hospital and healthcare, but you see the infrastructure and literacy barriers, and on the right side, you also need to address privacy, means patient's privacy, patient's family's privacy, and even patient died, his privacy is utmost important. And the security that we are talking about is security of our patient data. And integration challenge means the how one hospital's data can be transferred to the other hospitals. Here the infrastructure. In India, we have managed to provide 99% of our population now covered by the at least 4G mobile connection. Our 95% population is now covered within 3 to 7 kilometers of the one healthcare service provider, either is Ashaben, medical officer, or female health worker. So at least now we have adoption cycle going on for the digital health. But we will then elaborate how to address those barriers. To create the foundation of India's digital health revolution, we come up with one plan that is called as a JAM Trinity. So what is the JAM Trinity? You must have heard about the government promoting three Trinity component. One is the Jan Dhan bank account. That is zero balance bank account in beneficiary. The second is our well-known digital ID. It's our Aadhaar card. And the third is our smartphone for our connectivity. And this is launching back in 2014. Now it's nearly 14 years that we are evolving the ABDM ecosystem. So by the end of the 2015, we come up with something called as a digitally empowered society. So it has a different component. So first of all, what we need, we have achieved in 2015, we have achieved digital public infrastructure, which is utmost important for any digital health system to work for the country, for the people, for the society, and for the patient. So now we have a full-fledged digital public infrastructure called as a JAM Trinity. Back in 2017, with the new national health policy, we have decided to put digital health target within our national health policy. So we have a few component we embedded in the national health policy in 2017. One of the most important right now, you see in 2025, if you see my cursor, you see federated integrated health information architecture, and with this we have realized it through the National Digital Health Mission and the MBAHCHM. They will elaborate this further, but just remember, by 2025, we have actually managed to achieve federated integrated health information architecture, which is called as our MBAHCHM, which is interoperable for entire country, irrespective of who are your hospital or a healthcare provider. So this is important to know that the digital health target we have incorporated back in 2070. So we are nearly completing a decade to achieve it. So now let's try to understand. This is, I can understand this is very complex graph in front of you, but let's try to break it. This is very important for you to understand how India placing different building blocks to achieve entity called as National Health Stack. So if you see the component, I already mentioned about the JAM stack, JAM Trinity. So it is in you can see it is in your bottom of the slide. On top of that, we have a plumbing layer, and that is called as a electronic registries. Then second is a personal health record, and third is a electronic claims. So here, electronic registry means all the hospital and healthcare professionals to register with their digital ID. So all their relevant medical and nursing qualification actually now map to their Aadhaar ID. So that's the doctor registry. Now you see the personal health record. We can also create the electronic prescription, electronic discharge summary through our MBAHCHM. The next is the augmentation layer. There is a technical architecture of the protocol server, diagnostic infra, and the matching engine. And on the last, government and private application platform, where in the national health stack, it is divided in the two major components. So you see in your yellow top row, consumer apps and portal, and the second is the healthcare provider application and platform. So most of the focus nowadays is actually working in these two components to connect it seamlessly, drive your digital record, digital health record seamlessly between all the provider, whether they are a small, big, government or a private sector. Just let me ask, is any question, or are we taking question in the end of this presentation? Hello, can anybody help me whether we are taking the question in the last 15-20 minutes or?
Sir, end of the presentation.
Okay, thank you, Dr. Raghav.
Welcome, sir.
Are you able to see my next slide? National Digital Health Blueprint
Yes, sir.
2019. Yeah. So, Indian government, particularly two ministries, combined their expertise back in 2019. One is the Ministry of IT, and the second ministry is the Ministry of Health and Family Welfare, to combine their expertise to come up with a plan called as National Digital Health Blueprint. So now, as I told you that in 2027, you see national health policy, visualize it. And in 2018, we come up with the national health step. So this is the policy, and NHS is the your technical infrastructure. Okay. But it's just a platform. It is not the workable chunk for the hospital, for the patient, for the doctors, and so on. So we have started the journey in the national health policy in 2017. We have created national health state in 2018 as a foundation. But now in 2019, what we need? Workable unit of our digital health. And this is called as a National Digital Health Blueprint. So you see what we come up with the NDHB. So it is in front of you. Registry for patient, provider, facility, electronic health standards, national portability of the health records, multiple access channel for our healthcare services. So this is the gamut of services we have developed on top of our national health policy and national health stack. So in this slide, you see we have already come up with the policy that we would like to digitize the healthcare setting, healthcare service, and healthcare delivery of the India. But we have to put it to the working mission, and that is in front of you. Now you see, it is divided in three main components. So first, on the left side, you see Health Information Provider, HIP. The providers means who are creating, editing, and deleting the health information. And you know who are they? Public health programs, doctors, hospital, diagnostic centers, and the health lockers. So they are generating the health information, but where it should go and where it should saved and where it get utilized. The second layer of this building blocks provide us the gateway called as Health Information Exchange and the Content Manager. The Content Manager here, that it Content Manager decide which information goes where. If it is laboratory data, it goes in that server. If it is radiology data, it goes at that particular server. Okay. And on top of that, the other building blocks that we already mentioned in our previous slides, healthcare professional registry and health facility registry. Now, go to the rightmost vertical in the slide. Here you see on the left side we have a provider, but on the right side we have a health information user. So now you understand ABDM is providing the infrastructure between the health information providers and the health information users. On the right side, the same public health, doctor, diagnostics center, and healthcare token. So this is the bilateral view of any healthcare information you provide to the ABA system. This is also the component how it evolved from Health Policy 2027 to National Health State and the National Digital Health Blueprint in 2019. Okay. Once we completed the policy in 2017, National Health State in 2018, National Digital Health Blueprint infrastructure were ready. Now in 2020, we have launched on the 15th August National Digital Health Mission Pilot. It was restricted for the few states, and particularly I still remember it was Union Territory. Initially it was launched, and then by the end of the September 2021, nationwide launch of Ayushman Bharat Digital Mission happened. Now we are approaching nearly 6 years after our Ayushman Bharat Digital Mission. And India should take a proud that we have managed to create around the last figure that I remember is 80 plus crores ABA ID of the people. And that's very good achievement, giving the scale and giving the large geographical area that need to be covered, and the technical architecture and the manpower availability in the last mile of our India. This is considered as an excellent achievement to get digital ID of the patient in the government infrastructure. So now we have reached up to 6-year maturity of our ABDM infrastructure. Let me draw your attention. What are the core architectural principles behind it? How it works, when it works, where it works, it is called as an architecture. You don't have to go into that detail, but what you need to understand as a a student of hospital and healthcare management, when you go to the hospital and healthcare system as a manager, as a consultant, or as a uh, hospital administrator, you need to have a clear cut understanding how I can use ABDM for my day-to-day hospital and healthcare operation. Data, digital, technology, how it combined. So here, you see in the left side, you see the first component called as federated architecture and decentralization. Okay, let me give you an example here. You are working in the Maharashtra. Now you got the job in Rajasthan. Your whole record is situated in Maharashtra, but it is secured by the federated architecture. But now only you can request your hospital and healthcare record in Rajasthan. When you see any hospital or a doctor, you only can fetch decentralized patient record of yourself to show to the doctor in the Rajasthan. Okay. And it is called as a, this component is called as a interoperability. So it's a system communicate via API without central repository. So we don't need a centralized because it is decentralized and it can be transferred through the technology called as a API, application programming interface, that your data repository get transferred with you through your mobile and the OTP. And the second single source of the truth, that is other architectural principle. Here, the most important part in any hospital and healthcare record, it is called as a single source of truth. And that's what ABDM is created for. So you need to remember why ABDM. It's for single source of truth, which is following you in each and every hospital visit for lifelong. So it can't be altered without your permission. So here is the example. Patient visit hospital A in Delhi, then clinic B in the Mumbai. But the real-time update is always remain with the patient. So you need to remember this core principle. So now we have invested, now we have a infrastructure, now we have a ABDM, but does it actually helping us to achieve universal health coverage or not? As an expert in digital health, I always ask this question to the IT system provider, to the consultancy firm, to the student, to the professor, to the hospital administrator. We have spent millions and billions Indian rupees for the infrastructure, for the workforce, for the system to run in the cloud. But ultimately, what we are looking for as a hospital and healthcare system manager or a owner of the hospital system or a healthcare system, whether we are addressing the question universal health coverage. So now let's elaborate. In the center of the circle, you see the citizen and patient. So any universal healthcare coverage is actually focused on country's citizen and the country's patient. And the rest of the players are evolving their services, their tools, their technology around the patient and citizen of the country. So you see in the slide, we can see the policymakers, providers, insurance company, healthcare professional, non-profit organization, and the program managers like you and the state governments. Now you must have seen this image actually many times. What I would like you to know is the format of this ABHA card. It is a well-known card nowadays because we know credit card, we know debit card, we know Aadhaar card, and we know the PAN card. But the patient know ABHA card. So ABHA means Ayushman Bharat Health Account, which is 14-digit unique ID, which has a very minimalistic design, very minimalistic information of the patient who has created with the help of their Aadhaar card. So you see, that's the 14 number and the QR code. That's a typical identification of the ABHA card. So once we come up with the one tool, India is run on the card. It's a popular saying, isn't it? Wherever we go, we are looking for card. Credit card, debit card, PAN card, Aadhaar card. And now we added one more card. It is called as a ABHA card. Why we need ABHA card? So ABHA card, using the ABHA card, any hospital or a healthcare system or a doctor can identify and authenticate the patient, because they can verify with the biometric, they can verify with the face, they can verify with the OTP, they can verify with the photographs of your Aadhaar. Okay, so there are a multiple verification and authentication method embedded into the ABHA card. So in the right side of the slide, you will see the process flow of the ABHA ID. So now let me give you an example. You go to any trust hospital, you go to any corporate hospital, you can go to any government facility. You need two things with you. One is your ABHA ID. If you don't have an ABHA card, don't worry. You should have a ABHA number or either QR code. And your mobile with OTP. And then you can create your first personal health record on top of that. So in the last line, you see benefits. We asked question, why I need a ABHA card. So eliminate the carrying the physical record with you every time. So you don't have to repeat anything. Either it's a lab result, it's your medical record, your prescription, anything you carry with you in the hospital to see the doctors. The most important people in any healthcare system or a hospital system in the country or a corporate hospital, they are healthcare professional. Healthcare professional means here consists of everyone: doctor, nurses, traditional system doctor, allied health professional, pharmacist, everyone. Now, through their Aadhaar card, we have created one unique ecosystem to identify the health professional registry, where through the Aadhaar authentication, they can register themselves in the HPR called as Healthcare Professional Registry. So you need to make sure that when you become a administration of the hospital, if you owner of the hospital, if you are working at the hospital, make sure all your healthcare professionals are registered with this registry, because it's allowed to use the seamless platform of ABDM, your hospital system, and on top of that, patients' digital record in the ABHA server. It's accessible only through the HPR registered professional. So now you have a track record of two things: which hospital or healthcare professional actually viewed, edit, or delete the patient's ABHA related records. And that's why we are bringing the whole ecosystem working for each other, not against each other. Okay, doctor, can we have a 3 minutes comfort break, please? We will resume the 1750.
Sure, sir.
Okay, thank you. We will resume 1750 sharp. Yes. Hello, everyone. Can you hear me now?
Yes, sir.
Yeah. Okay. So, next slide. Health facility registry. That is the same which we have discussed earlier about the health professional registry. The objective is same. In the HPR, you registering the professional. Here that you are registering your healthcare and hospital facility. Okay. And it creates your unique ID that where the patient's care being rendered in the particular facility. Okay. This is also important for delivering and planning the healthcare and hospital services for the larger public and the patient. Now, important. This seems to be a very challenging one if you are not from the technical background. But you need to understand the very generic aspect of the UHI, that is called as a Unified Health Interface. So what exactly it is? So as I told you that now we have identified health service registry, for HPR and for the facility. So now we have a two component digitally ready. One is the professional and the second is the digital ID of the facility itself. But there are many patients, there are many providers. So now we need to make sure that we have a clear-cut identified protocol for digital health to have a access to those details. And that is called as a unified health interface. So it's a what sort of open protocol help hospital administrator or healthcare management professionals. So through the UHI open protocol, patient and your hospital can manage appointment, teleconsultation, digital health record exchange. Let me give you example that in the Mumbai and Delhi, okay, you are traveling between these two cities. Now your record distributed in the both city in the one of the corporate hospital. Now you can exchange your digital health record through your ABA ID OTP between those two facilities. One is situated in Delhi, one is situated in Mumbai. And that's the benefit of the NDHM, ABDM, National Health State, and on top of that, open protocol for digital health. So now, what are the application ecosystem right now we have, which is enabled by UHI? Okay, so here the current flow, which is existing system. Okay, it is fragmented. Nobody knows what's happening with the patient. But what doctor is looking for is the patient's interoperable record. Nurses would like to have a medication record. Allied health practitioner means the physiotherapy would like to know what was the actual situation of the patient that was treated in the earlier hospitals where patient visited. So UHI connect patients all visit irrespective of where he has actually seen the doctor, connected all the dots, and that is called as interoperability. operable health record in the various system. And you see the benefits are listed there. Next, ABDM stack. So here is the modular and interoperable architecture. You don't have to go in detail, but you need to remember what are the 3 layers making this happen. For the ABDM stack, we have a 3 layer. The first we already discussed, JAM and DPI, digital public goods. Digital public goods means it's nothing, it's our digital platform. So let's see UPI. You can pay any pharmacy or any doctor with UPI. Okay. Then second is a DigiLocker and the consent artifacts embedded into your DigiLocker. Okay. The second layer is a layer 2 health data exchange. As earlier I mentioned about that your Aadhaar ID is connected to HPR and HFR. Okay. And the layer 3, we just mentioned in our previous slide, called as a unified health interface, where we can connect the patient's all requests, whether it's a lab, appointment, telemedicine, or individual apps, either it's in eSanjeevani or any other healthcare provider apps. So what is beyond ABDM? We talk lots about ABDM, but ABDM is just for hospital and the patient. But India has achieved many other things in the primary healthcare delivery and the secondary care healthcare delivery. So first of all, let's start with the e-hospital. This is very interesting. Whenever you work in the government hospital, government related facility in India, you will come across this software. It is called as a e-hospital, and it's designed and hosted by the National Informatics Center based in Delhi. So it's 100% cloud-based and being used in a central and state government hospital. The another portal, it is called as a UWIN. This is excellent platform that where they are using the Internet of Things to trace the logistic of the vaccine. And the third is, you see in your slide, it is called as a eSanjeevani. eSanjeevani is a globally recognized one of the largest doctor to patient remote consultation platform. And it's run by the CDEC Mohali. They hosted the technical team, they hosted the infrastructure, and they hosted the development team in the CDEC Mohali. So that is the eSanjeevani. It is called as a National Telemedicine Services. And it is 100% Make in India product and services. Another more popular digital health platform, it's Telemanas, which is hosted in organization called as a MMH in Bangalore. MMH in Bangalore, if someone don't know the MMH, that is National Institute of Mental Health Science, where they have created the national level platform called as a Telemanas. And that's why it is available 24/7. And you see the also number, toll-free number also given, that anyone with a mental health issue, like a depression, suicide ideas, they can contact Telemanas service. And this is the one of the example that I do see actually working for the people. You just need to ring them and they will guide you and kind of guide you for yourself or maybe your family member, your friend. So anybody can actually call. It doesn't have to be patient. Anybody, if you see any patient or a person struggling with mental health, you can contact them and they will guide you for the nearest facility where they can get the treatment. UWIN, once again, Universal Immunization Program, digitization. So now we, through the UWIN portal, we are able to track each vaccine from manufacturing to the administration of that vaccine, end-to-end life cycle of the any vaccine digitally tracked into this UWIN platform. So whenever we talk about digital health, but we need to make sure that whatever we start, it's sustained for the India, for the patient, for the public, for the community. So in 2024, we have initiated digital health transformation. So there are a few big players come into the play, World Economic Forum, Apollo Hospitals, and so on. And they are building their ecosystem. One of the most notable digital health sustainability initiative that I saw, it's a Google and National Health Authority come up with their plan. So if you would like to note down, check One Health, note it down for your record. What exactly Google and the National Health Authority is creating, that is called as a One Health. So they are building digital health platform in the Google infrastructure. So we have talked about the state, we have talked about the India, we talked about our hospital, our healthcare. Now let us view digital health at a global stage. What's happening at a global stage? And you already know, as a hospital and healthcare professional, or maybe the people from the other domain here attending this lecture, the WHO, means World Health Organization, they provide us the global strategy. Okay, and the same WHO also providing us digital health strategy. So right now we are on the 5 years digital health strategy adopted from the WHO that we are adopting in India. Now it is actually extended up to 2027. So you see, we have a strategic objective set by the WHO. So we have a 4 strategic objective. It is in front of your, it is front of you. Collaboration and knowledge transfer, digital strategy implementation, digital health governance, and the human-centered health system. So this is the 4 components that you need to remember, that how we are adopting digital health strategy from the WHO. What are those four components with the four strategic objectives? So now let's elaborate global strategy and what are the major achievements of the WHO digital health strategy for the developing country. So in total 129 countries have adopted the WHO guideline as a national digital health strategy. Total 1.8 billion people across the 80 countries are affected by, actually have a benefit of this policy. And during the India's G20 presidency, we have achieved the one platform. We have launched it and we have run it successfully. For 1 year, it is called as a global initiative on digital health, where many countries came to India to see how we are adopting the WHO global digital health strategy. So this is the global level digital health market snapshot. You will see these figures. The most important figure is next 5 years. You see the growth rate. Here you see the growth rate is 25 to 2030. It's 17%. So as a postgraduate degree holder from the Indira Gandhi National Open University, you don't have any, restricted career trajectory from your original degree, but you will also explore many more career options. So you see, this is global digital health market snapshot and projection itself, a huge opportunity student like you who are pursuing this masters in hospital and healthcare. You can go to the technology company, you can go to the consultancy firm, you can start your own consultancy firm to assist the technology company, pharmaceutical company, or a hospital to adopt the digital health and tools and technology, sorry. But as India, where we are actually spearheading the global digital health movement. So we are actually in some initiative more successful than even the more developed nation in the world. So we have a single system like ABA-ID, even NHS UK, National Health Service in UK, they are struggling to get single patient record. But we already have started with the ABA-ID, that we have one person, one single record in whole of our nation. And National Health Service UK now designing the single patient record. So we are far ahead than them. Already we have a single patient record for our 80 crore ABA-ID holder. And this is very good achievement. So health system and digital transformation. So this is the other component. Here is listed electronic health record, electronic medical record, and a personal health record. On top of that, we have a hospital information system, laboratory information management system, finance information system, and the telemedicine and telehealth. We already talked about it. In the trajectory to be able to provide the digital record for the patient, for the hospital, one of the most important aspects that Ministry of Health and Family Welfare provided to the technology company, to the hospital, it's called as EHR standard for India. Whosoever interested to take trajectory into the career in digital health, make sure you download this document from our government website and study it carefully. Electronic health record standard. So we have three standards here. One is the code system, means we have a different terminology like a SNOMED, ICD-10 and 11 and LOINC. We have a EHR standard for data exchange, HL7, FHIR and DICOM. This is the exchange standards. And a communication standard and the other relative guideline about the privacy security of the record like encryption, audit trail and so on. But this is the document that I recommended you to read to understand how EHR standard is evolving in the hospital. Two model working for us in India. One is a synchronous real-time telemedicine and the second is asynchronous. The most useful one in asynchronous which I come across, it's teledermatology. It's very important that the patient just send the image through the ABA ID and they can locate the dermatologist available to review your skin lesion and the particular doctor can prescribe the medicine and that is available in your ABA record. So it is important that to understand synchronous and asynchronous world of the telemedicine. The other central and state government initiative that's happening in digital health world is the e-hospital. We already talked about it, and smart OPDs. And the most of the time that you will see a few hospitals adopting these tools in their day-to-day outpatient and inpatient. Now let's talk about the newer model of healthcare service delivery. The most of the time we are talking about the how we can effectively and efficiently use the digital tools and technology. But most of the newer model of the healthcare service delivery nowadays is actually happening via digital. And why is that so? Because nobody like to handle the paper. Nobody would like to explore the books. Nobody would like to understand the text. In the emergence of the ChatGPT and the other tools, that is called as a generative AI, it's effectively creating the new healthcare service model. Let me give you an example. If you see on the right side, the line C, telemonitoring and remote patient monitoring. In the advanced nation, in the developed country, most of the patients who are at the age of 75 and plus, they are using some sort of wearable and sensor into their home or a care home to regularly get monitored by the hospitals or a nurses, especially trend for identify any complication for the old age patient. So this is the new healthcare service model already already in use in Japan and Norway and Denmark. As we start adopting the digital health, we have to make sure that we can create the patient-centered model by utilizing the whole digital care horizon. One of the most important emerging innovation that I come across, that is point of care diagnostic. So in the village, if you would like to check someone's blood, like urea or creatinine or a hemoglobin, we don't need to get patient's blood to the lab. But a point of care, small diagnostic lab, which is very handy, it requires only one drop of the blood and it's analyzed the patient few parameters that we can quickly diagnose the patient, whether the patient is normal or any blood results getting abnormal, to transfer the patient to the hospital. You must have noticed in last couple of years, most of the new hospitals is come up with some plan for the smart hospital. Why? Because it is creating the value for the patient, for the doctor, and for the hospital and healthcare system itself. In Unit 4, we will discuss healthcare IT standard and regulatory framework. So here you see we already mentioned about the HIT standards, like a LOINC, ISO IEC 27001, SNOMED CT. This is what you need to do. It is, you just need to remember the name of this standard. You don't need to go into the detail, because that itself is another domain called as a health informatics. So healthcare interoperability, you will hear this word many times when you go into the actual hospital. Why my record is not interoperable? I would like to send this radiology report to my doctor sitting in Madhya Pradesh. I would like to send this lab result to my family doctor in Gujarat. The issue is healthcare interoperability. Once we are agree to connect our record with the it is in a red font, it is called as a syntactic and semantic interoperability. So once we achieve this level of interoperability, we should manage to send our health record across the hospital system, across the facility, across the provider. This is the new standard. I don't go into the detail, but you just need to remember HL7 means health level 7, and the FHIR means fast healthcare interoperability resources. This is important act. It's coming in June 2027. This is what you need to remember. By 2027, around June, there is a new act, Digital Personal Data Protection Act, that is specially designed for Indian healthcare. And when DPDA Act is on, you see notice penalty up to 250 crore per breach. Can you imagine that one single record of the patient your hospital is holding, and due to lack of vigilance, lack of any control, if it get distributed by any means, whether cyber attack, someone is stealing your data, someone crash into your server, or someone just selling your data, you as a hospital owner, as a hospital executive, to deal with the penalty of up to 250 crore per breach. So make sure as a hospital and healthcare professional, you read this DPDA Act 2023 carefully and understand your role. And this is the a critical provision for healthcare administrator. You read it carefully. And the Unit 5, Cybersecurity, Privacy, and Ethical Data Governance. Now, as you know, that we are already waiting for June 2027 when exactly DPDA Act is going to be live in our hospital ecosystem. So we need to identify what is our cybersecurity like, what do you mean by privacy, and what do you mean by the data governance. So you need to make sure that you understand this aspect of the DPDA Act in your day-to-day practice, and make sure if you don't know, ask someone who is the expert into that particular cybersecurity, privacy, and ethical data governance in your hospital team. So what sort of initial cybersecurity defense you have? So first is a principle. There are a total 5 principles you need to follow. Zero trust architecture, multi-factor authentication, role-based access control, and air-gapped backup. And this is must know for all the hospital and healthcare professionals. This is very important. You already know NABH, but now there is a special version of a digital, NABH accreditation for the digital health. And it is available in the main NABH website, how to get your institute NABH digital accreditation. Blockchain, extremely important for DPDA Act, because in blockchain you can track each and every access of the patient record. So if a patient's record is getting breached, you get automated notification, and that's a blockchain. You can track each and every record access of the patient by ABC doctor or ABC nurse. And the summary, what are the key takeaways? So right now, India is sitting on the trajectory of the 100% digitization in next 5 to 7 years. We have a whole standard, we have a whole infrastructure, we have a policy, we have a practice, and we have a workforce ready for that. it is now the time that decide what sort of digital maturity that as a India we can get into the our hospital and healthcare system. Thank you very much for your attention, and I'm happy to take any question or any discussion that you would like to elaborate anything further. Yeah, ladies and gentlemen, I'm happy to take question.
So can you explain it once again? WHO Global Strategy on Digital Health 2025, four strategies, objectives. I mean, how WHO is working on these objectives.
Yeah, so in the WHO point of view, WHO provide the generic guideline to all the developed and developing country. Okay, so in the WHO, they have a group of country. So let's see, we comes under APAC, Asia Pacific WHO region. Okay, and further to that, we come under SERO, South East Asia region under WHO. So in the WHO global, they gave us the global level strategy component, and then we, as a developing country situated in the Southeast Asia region, we will further refine it according to our use, our usability, our digital maturity, investment, and the policy by the government. So you will notice the main digital health policy from the WHO differ from the our digital health policy in India. But main principle will remain same: digitally enabled hospital and healthcare. Next.
Sir, what are the major security challenges in digital health data sharing?
Yes, Dr. Raghav. So, even the Indian government has provided ABA ID, secure access of your ABA record. Okay. Still, uh, the one component called as a social engineering of the cybersecurity, it still prevail in the many hospital and healthcare system. So even we have a robust data protection act, we have a robust security system, we have a robust OTP secured and OTP enabled ABA record sharing. Still, many hospitals, they don't care about it. Many doctors don't care about it. And they are just simply sharing the patient record with unintended user. So that's we have to make sure that we add the social engineering component of the data breach to prevent access to the patient record. It is everyone's responsibility. It is the patient's own responsibility, doctor, hospital, legal framework, ethical, data governance, and the policy at large.
Thank you, sir.
I'm expecting lots of question from across the all the professional. I do see lots of student hiding behind the screen. Because digital health in the hospital and healthcare industry, you can't escape it. You have to use the medical record, you have to use the data, you have to use analytics, you need to use business intelligence. That's all the part of this module. And
So what is
sorry,
air gapped backups?
aircraft is it's the component which when breach happen or about to happen, that you actually disconnect all your system. Okay, so we call it an airtight component, let's say. Okay, so if you are suspecting that the data breach happened in your server, maybe someone trying to access your record. So let me give you an example. Okay, someone has stole your ABA ID. Okay, now she or he would like to access your medical record, and they know that they have your mobile access. Okay, so they can actually put the OTP into it. And now you come to know that one of the hospital now actually try to access my record one or another way. So what you're going to do, it's you lock your ABA ID. You can do it. And that's important aspect of the air grapple service. So you can actually entirely block your ABA information and record itself. So even they have access to your ABA ID and your OTP. They can't access it. So second layer of defense, like a biometric in your mobile, keep that access.
Sir, audio is not clear.
Hello. Bro, can you mute yourself, please?
Yes, sir.
Yeah. So in the air grappled philosophy, what you need to understand that once you feel insecure about your record, you can make it airtight. So you can increase your defensible layers on top of that. Anyone else? Next.
So can you repeat about IT standards LH7 FHIR?
Yes, it's too technical to explain, but let me explain with the example. So HL7 and fire, this is the actually for software developer. It's not for hospital and healthcare professional. But what you need to understand as a student of this postgraduate degree, that HL7 and fire enabled service are in the rise. Okay. So when you approach any hospital information system provider or maybe electronic health record, what you need to ask them, it's whether your EHR or whether your solution is HL7 and fire enabled or not. Okay. And you need to make sure that they show you the each and every interoperability standard to your all the user in your hospital. Okay, health level 7 standard, if it works, is automatically grab radiology result and laboratory result directly digitally into your hospital information system. So you need to remember that whenever you approach a digital company who are providing you the solution, make sure you ask this specific question and ask them to show the actual interoperable system with these standards. And if you would like to know more, there is one website called sahl7.org, and you can learn more there regarding the HL7 and the fire component of the digital system.
So website name, please.
Just write hl7.org. And even I recommended, if someone is interested and they are too technical, they can certify themselves as a HL7 expert, and they can get job in many technology company around the world. Some standard in NABH. Yeah, so Vikram, it's nearly the new things I come across in NABH. But NABH digital, what exactly it is? Okay, so now let's see, you have a NABH standard for your hospital and healthcare system. Okay, so it gives you the measurement standard. Okay, whether you are compliant or not compliant. Okay, am I right? So now, this is only for the hospital and healthcare system, whether you are actually compliant or non-compliant to the NABH standards. But now, you have adopted the new digital system, like a telemedicine, maybe hospital information system, electronic health record. NABH digital measure the maturity of those systems. And that's how the standard is created. So now let me give you an example. In a NABH digital guideline, you have a digital component maturity to be measured against the set standard by the NABH digital. And I have briefly gone through with the NABH digital standard, but you need to go in deep to understand what are the digital maturity standard and how it get measured. So in NABH, they offer every 2 or 3 months, they offer 3 days training program to be able to understand. There's a 3 years full day program for training for the digital health standard from the NABH. So if someone is interested into the digital health system in the hospital, how it does work, how to evaluate and how it get matured, I recommend to go to the NABH website and you'll see the training program availability in their calendars. So now we are nearly approaching the end of our session, but if you still have any question, any concern or any help you looking for your career, for your trajectory, for your understanding, feel free to put into the chat and later on I will review it.
So what future developments are expected in digital health ecosystem?
Yes, Dr. Raghav, lots of happening now and lots of will happen in next 5 to 7 years. Most of our system are now getting digitized. So we will require lots of digital health professionals like health informatics, clinical informatics. Lots of new emerging role is coming into the play. The other things that as we are now adopting the artificial intelligence, machine learning, generative AI, but the most important component I would like you to learn, it's the multimodal language model in hospital and healthcare. So Google is providing the platform. Azure is also providing the platform that is called as a multimodal language. So you must have heard about LLM, let's see, large language model, but it's exclusively to do with the text of the medical. Okay, you know the diagnosis, treatment, lab, etc. But application of the multimodal language is a huge in Indian healthcare system. Let me give you an example of live translator. Okay, if you don't understand the patient language, when patient even speak in their mother language and it get translated into English where doctor can understand, and it's a live streaming of the spoken word of the patient. The other application of the multimodal language model, it's that we can use image, we can use the sound from the different medical diseases. Let's say if patient has a problem with their heart sound change, and it automatically detect the patient's heart problem. So you can utilize the multiple input from the hospital and healthcare by utilizing the power of generative AI. And Singapore, Estonia, and many countries, they are far ahead than rest of the other countries. They are utilizing the different model of multi-language, multi-LLM for hospital and healthcare use. Multimodal language model is going to be a key for in the future, and lots of other technology coming in like a digital twin, another cloud infrastructure in for the training and so on. But it will take time, and we'll see what exactly is the outcome it's producing for our professional and for our patient.
So, sir, you were trying to say that we should learn this how to use MLLM.
No, you don't need to go into the technical expertise, but you need to see what are the use cases emerging. Okay, so let's see if we have a translation problem that it give you the live streaming of the patient's spoken words into the doctor's language, like either Hindi or English. If patients send the image of their skin, okay, or a eye, or a other body organ, or other condition, it automatically detect primary diagnosis and alert the doctor. So let's see if you sending the in the multimodal language, it's combining the expertise from the text, from the image, from the sound, and other sensory input. So it's the combination of the intelligence put forward into our healthcare system. So we can utilize power of each component: sound, image, text, and other sensory inputs. Once you combine the intelligence of the few components, it gives you the better result, and it has a more impact in the patient management. I also would like you to see, it is called as a One Health from Google. They are exploring these all options. Okay, I hope that I took you in the journey of first module, digital data technology, governance, AI, and emerging innovation that's actually the part of hospital and healthcare industry. Lots of investment and hospital this newer technology. But make sure that you analyze the trend, you know what is working, what is not working. Give honest feedback to the policy maker, to the buyers, to the technology company. Because you are a hospital and healthcare manager, you know what should work or what shouldn't work. Okay. All the best. Should we now close this session if all are agreed? Who is the anchor of this session, please? Hello. Who is the anchor of this session?
Sir, it's from RC Noida 2.
RC Nodal 2. Okay, I think they. Can we message them or RC Nodal 2? Let me check if they are available. Okay, they are not, but anyway, thank you very much for attending this session, and we will see you. I'll see you tomorrow at 5 p.m. sharp for the hour day 2.
Okay, sir.
Thank you, sir.